pain is one of the main reasons that people will seek out therapy in their dogs. Anything from intervertebral disc disease to spondylosis, which is when the vertebrae start coming closer together and basically fuse. And in a lot of these cases, we end up with dogs that have neurological effects, which mean that they could be dragging a toe, they could be knuckling over and not able to regulate it, or in very extreme cases, we see paralysis, incontinence, things like that. There's a multitude of modalities that we can use in these cases depending on what the diagnosis is. Everything from shockwave to EMTT, techotherapy, or even laser. Chiropractic may or may not be correct for those diagnoses. It really depends on the extent of the issue. And the same goes for manual therapy. So we have many, many different options. Today we're going to talk about EMTT. EMTT is extracorporeal magneto-transduction therapy. And what this does is it works on a neurological level, so it really goes according to the frequency that is very similar to the nervous system. So it helps us to upregulate the nervous system and get it back on track, almost like rebooting a computer. So if we were going to be treating Cabo's lumbosacral spine, which is an area that he has some trouble in, this is how we would do it. As you can see, he is a really good boy, so he's fairly easy to work with, especially when there are cookies on board. So you can see when we get over this area how those nerves start to fasciculate, and that is how we get the tissue and the nervous system back on board. So very often when we work around these areas, you will actually start seeing movement in the tissue, in the nervous system, as well as the spine itself. So this is a very safe mechanism, and you can see a little bit of what we call a fasciculation, where the muscles start to tremor a little bit as they start coming on board. And this is a fantastic way of helping with neural regeneration, as well as improving muscle capacity, blood flow to the area, and really being very, very effective from a neural perspective, where we can't do anything that is exceptionally invasive.